So when you first log in, you'll see the last case that you worked on. If you click this button here, you can see all the cases that are there. And if you want to just search on by claim, you can click on search by client name. You can do that. So it's a pretty simple way to move around. On the bottom is the navigation, and if you want to add a new client, you would hit plus, and that lets you build a new client. I won't go too deep on the importing of it, but needless to say, if you do want to add a client and you want to take something out of Health Connect and put it into our system, we made it really easy to do that. So let me give you a quick demo on how to do that, because that's one of the things that stops brokers from using the tool, is they think they have to rework all of that data information. If you go into the plus, that opens up a new case, it gives it a new name, and if you want to, you can import the plan by a clipboard or a file. If you do it by a clipboard, it'll open up this screen. So let's say that you had a Excel spreadsheet and you wanted to import it into the tool, or you had a PDF file that you want to import the pool. So I'm just going to give a real simple demonstration. So if you had an Excel sheet, what you would do is you would just basically cut and paste whatever you have, and I've copied it, and then I'll just paste it in here. Now, whether it's 4 people or 50 or 100 people, it does the same thing. Whatever you have in there gets entered into the system, and when you click that button, it tries to find as much of the detail as it can and tells you what they found. So, for example, these are the things that we're importing now. It found the zip code automatically, it found the dependent, it found the birth date, and it says first name. So if that were the full name, you'd click on that and say, oh, that's the full name, and then it would say, okay, I got it, that's what I want to do. If you want to delete something, you can by using that. If you want to make that a dependent, you can. So that's when you're working with Health Connect and you export your census and then you import it in here, it names the company as the new company, and you can keep it just that name, New Company 136. You can call it whatever you want to, and then when you click that button, it's going to create the census and say, okay, we've got that in the system now, and you can move forward. So that's a pretty simple way to import a census, and it does a really good job of finding it, finding the information, including emails and whatnot. So if it's there, you would work at it. So I'm going to go back to the overview, because I want to go back to this particular company. So if this was the new company, you could give it a new name and you could tell it what the renewal date is, and whether it's a small group or an individual, and then the payroll periods, and then you can give an administrator of the group the right to go in so that they can just see their case. So if you have an HR person or an owner that wants to go into the tool, you can assign them protection, access to just this case. On this one, you can go in and add it to your group list, and then when you give them the administrator, they can go in and do some of the things that you're doing on their own, including modify the census and do all the other things that you might want to do. I'm going to go into I hit that star button. I'm going to go into the front page again, and I want to pull up the one that has a little bit more meat to it than just the one that we were on. This has 27 employees, so I want you to see the speed of it and how it works instead of that 4 light. On the bottom here, you've got the census, and from the census, you can add, change, and delete, and modify it, and you can assign everyone in this group a particular plan if you want to. So you can say everybody has the same plan. So when you're doing a comparative, you can do that. You can say, okay, I'm going to give everybody what they currently have, but let's say you're in a CalChoice product. You could assign each person what they have, and that plan stays with them as they do the comparatives. Under Health Connect, when you do a quote there, you usually have to get to the numbers, decide what you want to quote, look at the comparative, and then kind of go back and forth a few times. So we do it a little differently. What we do is we quote the 400 plans, and the quote's on the right side here, and the plan is described, and you can sort by these kinds of plans however you want to, but you already know what the quotes are. So if you want to put those in order, you just hit rate, and now you're going to get them from highest to lowest. If there's no rate, that plan is not available for that zip code. And it'll tell you what the plan costs are by price, and you can set that up however you want to. So on the left over here is you're going to see that these are your filtering. So if you decided that you knew this was a Kaiser case, if you click on Kaiser, it'll give you all the Kaiser plans in order. If you know that you're going to just show a gold plan and a platinum plan, now you've got gold, platinum plans. And if you know it's going to be an HMO, you got rid of anything that you wanted to, and now you're kind of squeezing it down to see what those plan comparisons look like. And then if you wanted to add another carrier like Anthem, you'd add that, take Kaiser off, and now you're looking at the same thing with Anthem. When you're starting to filter through the plans and you want to see what it is that you're going to offer them, you hit selected, and this says that we've selected these plans because it turns to green. So every time you want to add a plan, if you just click on it anywhere in the group, that just adds it to the 12 plans you're going to quote, which makes what you're going to show the client, you don't want to show them 400 health plans, but you want to show them that you have 400 health plans. But the last thing they want to do is see all 400, right? But showing them this shows that you're aware of all the plans immediately, which takes away the process of, well, is he showing me plans that he just wants to show me, or is he showing me the market so we can decide what plans to pick? The selected and unselected button says that you've picked a couple of dental plans, and I'll go through how you do that. You pick these plans, and I don't really care what we want to show, but if you unclick them, you're going to, now it's just showing them down to the selected plans. This next page just basically says, hey, you got rates for all the plans that you picked, and if it's a green thing, that's good, and if it doesn't say that, you need to add the rates to it. So if you pick the plan that we don't hold the rates for, you're allowed to put in any plan rates that you might quote. So how does that work? Well, if you're in large group, or if you have a large group quote and we don't have the rates in there, you add that plan and you put the rates in, and then the system will take that and compare it. Now this is one of the most important tools. This is called your budgeting tool, and what you see is just the minimum amount of information the client would have. But this is where you could decide, you know, there are 3 strategies that you could use in selling health insurance, 3 principal strategies. You do a defined amount of money, and you say the budget is $5,000. If you say it's a defined amount of money and you hit employees, it'll take that amount of money and divide it by all the employees and say, okay, everybody gets $294.
Mm-hmm.
You can also say, well, instead of doing it as a percentage, as a fixed amount, you can say, I want to do a percentage of any plan that we selected, and by hitting that, it says to that the plans that you selected will give you a pricing range. If you pay 100% between here, if you decide to pay 85%, the contribution level will be here. If you pay 65%, the contribution range would be here. Now, most brokers and most employers don't use that, but every so often they might say, we're going to pay 65% of 3 of these plans that we're going to give. And this number here just says we're going to let the computer calculate that number. But most often what they do is they say, let's pick a base plan. And so you hit base plan, you tell it what the base plan is, and you find the plan that you say is the base plan. And if they say, okay, we're using the Gold Select plan, then you can pick any carrier plan that you want to be as the base plan. And then from here, you just click on whatever plan that you want to. So say you were with a client, you're the broker and I'm the client, and you would say something to the effect of, last year's budget was $7,000 that we have, and last year it paid 95% of the plan.
Yeah.
That plan. This year it's only going to pay 80%, and then you have a conversation with the client and says, you know, are we going to pass all the cost on to the employee, or are we going to pick up part? The employer might say, well, you know, it's gone up 25%. We can't pass any of that along. And you say, fine. So then what you would do is you'd click up here and say, okay, then you can decide what percentage of what plan you want to offer. And then those numbers on the left corner, that's what the employer is giving in the gift card approach, and the employees get to use that money however they need to. Now say that they also pay 50% of the dependent. Yeah, so whatever dependent they want to give, that's fine. And then whatever employee wants to give, that's that top bar. And then whatever plan that you want to give, then what you would do is you'd pick that. You'd say, oh, what plan do you want to pick? And then you'd say, okay, it was a HealthNet plan before, and it was a Gold PPO plan. Now you've picked that PPO Gold 80 plan, and then you can use the bar up here to decide how much of that premium the employer is going to pick up and how much the employee is going to pick up. So if you said, well, about what is that going to cost the employee, you'd go from 75% and you'd say, well, you go to 25% and say, well, this is what the contribution level is for the employees every month. Yeah, because they want to know, well, shoot, you know, what is that going to cost the employees? Is that going to be a lot more than they are? They're paid twice a month, so you say, well, you know, they're going to have between 100 and 150 depending on their age. They know what their employees are making, and they know, you know, is that 10% affordable or not based upon what they're making? And, you know, that would mean that if they're not making $2,000 a month, that would mean that that's considered unaffordable. But you make the calculation pretty easy, don't you? Go ahead and hit the right green button on the bottom there. And that's just going to take you along the breadcrumbs where you went from the cost sharing to the report. Now the report is sort of like your printed report that you would have with Health Connect, except it's live. You can then make the comparative between these different plans. Now I kind of grouped them all together, but you can kind of see the idea that you can see any plans that you want to and decide which you want to show. So this left and right arrow says you've got 8 plans that you've picked. It shows you what the co-pays are, if there's any. It shows you what the rates are per client. And then it gives you a comparative claim model if you have an average, high, or low utilizer. Now this is where brokers that are really consultative can be completely different than anybody else, because no one has anything like this out in the field. Now, oftentimes it's a little bit over the head of most clients, but I think it's useful to show clients because it shows them something that no one's ever been able to show before, and that is efficacy of a plan should you decide to use it. And this is how it works. So it's all based upon this model over here that says if you have average claims, we know on average that 30% of the population will have $1,000 of claims, 20% will have 2, and 10% will hit the maximum or have a big claim. So when you move the cursor over here, it says based upon that medium claim, if you compared the total amount of premium and the average claim that we just said, it'll show you what the cost comparisons are from each plan and how it would actually scope out if the group had these average claims. If they moved and said, oh, we've got a pretty sick group or we've got a lot of pregnancies, you could show them that. And if you had groups, you know, where everybody's male and 25 years old, it would be that. Now, all that's going to do is help you drive them towards the most effective health plans, but you don't have to pick the most effective health plans because we're going to show a defined contribution, a defined benefit model that this may be true for the entire group, but what about each individual? You can show, if Sue is the name of the owner of the company, you could click on anybody's name, and this is something else that's totally unique and different than anybody else's software. What it did is it said it compared the premium that the employee has to pay, right? That's the $351,440. And then it took the maximum out of pocket, divided it by 12, and amortized that over a year to show if you had no claims, that's the premium. If you had maximum claims, that's the premium and the out-of-pocket maximum. And if you had $1,000 of claims, that's where this plan would compare. It's a little bit over the head for most people, but it's something no one's ever been able to see before. And we'll drill this down to make it an easy selection for the employee even easier. So what you would do is you'd go back into the tool and say, okay, do we want to show all those plans? Now let's just say that we're going to, but you don't have to. You just unselect those plans. So you go back to the overview and you click this little button here. It's called the email button. And everybody that has an email in the Census would receive this email that you would customize for yourself. And you'd write in there whatever you think is the right message for the employees to have. You just save it in your Word document, and then you cut and paste it into here, and you've got a brand new email going out. But it does something that's really important. It creates a special link for each employee, and you would see this link embedded in there, and the employee would automatically receive this email with instructions as to what to do. When the employee sees that email, they're gonna get the email, and let's say that Charles is the owner of the company, and you say to Charles, let's look and see what you would receive. That's what I would do. So Charles says, yeah, that's great. Let me see what you're going to show me. So what would happen is the employer would receive this in an email form and says, oh, you're going to get $151 per pay period towards your health insurance. And then you'd ask them to click this little button and listen to the dialogue, and it would walk them through.
Compare makes it simple. Identified by the gold star, you will easily recognize which healthcare plan will most effectively cover your claims while giving you the best economic value at the lowest cost. Your employer, together with their insurance broker, decide the total number of plans that will be offered to you as an employee. The 3 plans that you'll see once you arrive on this page represent the top 3 smartest plans that you can pick and enroll in. BenefitCompare calculated these as your best choices based on the answers you gave on the profile questions. Why are these your best choices? Let's take a closer look. Let's say you're looking for a new car. It's like anticipating your expected maintenance and gas expenses together with the sticker price before deciding which might be the best car purchase. Considering all the factors can lead you to the smartest and most effective purchasing choice. The same holds true for purchasing health insurance coverage. When you answered the simple questions, it allowed BenefitCompare to calculate your anticipated claims for the forthcoming year. Your best choice may not be easy to identify clearly because it may require a higher monthly premium. BenefitCompare considers all of the variables, calculates the different possibilities, and revealed to you is the plan that overall most effectively covers your claims at the lowest cost. And that's good news for your family's bottom line. Although no one can forecast the exact amount of claims you might have for the year, correctly anticipating some obvious claims can give you a really big advantage. This is further illustrated in the graph. Each of these lines on the graph corresponds with one of the 3 top plans. Now, as the amount of your anticipated claims change, the best plan for you may change, easily identified by that gold star. And remember, at any time you could modify your expected claims and adjust the anticipated cost of doctor's office visits, hospital charges, and expected prescription charges for the year. It's easy for BenefitCompare to automatically recalculate your adjustments and once again point you to the best health plan decision for your family. If you'd like to compare plans even further, you also have the option to consider some of the other health plans that are being offered by your employer. You can compare plan options with family members included or excluded. To verify if a specific doctor is included in an offered plan, you can click on the provider link so you can search for your specific doctor. And you have the option to view the benefit summary. You can see in more detail what each plan has to offer and what it covers. Now you're familiar with how BenefitCompare can point you to the better health plan choices.
So now, remember, you're going through this with your client, and the client says, okay, well, yeah, you've got everybody in there, but if they forgot to tell you that they had a child, they could add somebody else right here in their tool. I'm going to just click through here and say this guy is sick. Now, is he sick? It does this claims estimator over here on the left side. You ask a few questions, and once you go through those few questions, it creates a calculator, and says, based upon your high utilizing of claims, that plan will give you the top lowest cost. But if you were now wanted to consider the difference between Kaiser and United, you'd see the differential between it very small, and it'll tell you what, that somebody say, well, yeah, I don't want necessarily the cheapest one. I want to be able to go to different providers, right? So this indicates the amount of money from the company. Indicates the amount that the employee has to pay. And then they can change any of the claims amount that they want based upon, just moving the claims around. So they could say, well, if I have 0 claims here, and I just have some doctor visits, it then changes the metric. Oh, well, if that's the case, this silver plan actually is still the best based upon that. So it depends. Now, if they take off the kids by unclicking this top bar up over here on the left side, it recalculates everything because now you've got a different set of circumstances. So if they want to look at the plan summary document, they would hit that. That brings up the plan summary document because nobody remembers all these plans anymore, right? I mean, there are 400 plans that are new. So all you have to do is click on those, and then you can walk the client through it. And if they say, well, that's the one that I want to pick, then that adds it to the chart. And then we have 2 dental plans in there. And they could click to see what the cost would be for the dental plans. And now they would receive, now what you do is you'd send them the PDF files, and the enrollment forms. Now, remember, we gave you all the enrollment forms. So when you go back into the tool, Charles, whatever he picked is now going to show up as that's what he decided to buy.